Welcome to the video on giving information in communication. As doctors looking after children, we encounter a lot of occasions where we have to give information to parents. For example, if you want to do a lumbar puncture in a child to rule out meningitis, you will have to give that information to the parent. But sometimes the parents can be very anxious and be afraid about the outcomes of such an investigation, and they may really worry about what they know and what they have heard of from their relatives or their friends. And in the same way, we may have to give information before doing a procedure like bone marrow biopsy. And sometimes you will have to give information about a medical condition, like a child presenting with a febrile convulsion. Although we know it is a benign condition, sometimes a parent may be very anxious and be afraid to witness another convulsion after witnessing the first convulsion. So it is very important the parents be given the right information about the child's diagnosis as well as child's future, and that forms an important part of management. We are going to demonstrate a doctor-patient consultation where the doctor is going to give information regarding a lumbar puncture. And we follow the principles of the Calgary-Cambridge communication model in giving information. Let's watch the video.
Yes, come and have a seat, please. Good morning.
Good morning, doctor.
I'm Dr. Ayesha, and I'm the doctor who is looking after your baby. So am I speaking to Mrs. Minoli Senapati, who's Lakindu's mother?
Yes.
Yeah, nice to meet you.
Nice to meet you, doctor.
Yes, today I'm here to talk about Lakindu. So as you and me know, your baby was admitted to the hospital 2 days back,
Yes.
and he was quite unwell. He was admitted with high fever,
Yes.
isn't he? So how is Lakindu doing now?
Now, because I think they have given some medicine, he looks a bit better, but I am a little bit confused about this whole thing.
Yeah, you were also spending the whole time with Lakindu for previous 2 days, isn't
Yes,
it?
yes, doctor.
What are you as a profession? You were doing a job, isn't it?
Yes, I teach maths for grade 6 students.
So you're hardly managing your time to be with Lakindu, isn't it?
Yes.
So today, actually, I want to talk to you about what we are going to do for Lakindu, basically regarding the testing to find out what is happening with Lakindu. So we have planned to do a procedure which is called lumbar puncture. So have you heard about that term, lumbar puncture, or any procedure like that?
I didn't know about this name, but I heard some nurses speak about pricking his backbone or something like that.
Yeah, that's kind of same thing like that. But I would like to explain you more about the procedure and how it is done and why we are planning to do that, and what are the things which can happen after doing the procedure, and also what are the precautions that we are going to do. So I would like to speak in that order. Are you okay with that?
Yes, doctor.
So is there anything that you want to know regarding it, other than the things that I have told you?
I just want to make sure that he's not in pain when this is done.
Right. So I'll explain you about it. So first, since your baby had high fever and he has come with abnormal behavior and admitted to the hospital, we have planned to do this procedure, which is called a lumbar puncture. It's so we are doing it to find out the cause for this high fever, whether there's any infection which is caused by a virus or a bacteria, and also we have planned to do it in today evening. In this test, we are inserting a small needle in between the bones of your baby's backbone and getting some fluid out of that, and as 5 samples, and we are sending them to the lab to proceed. In doing this procedure, we are keeping your baby in lying down position. And you were concerned about the pain, isn't it?
Yes.
Yeah, we can apply a gel called EMLA, which can cause a very minimum pain to your baby during the procedure. So, did you get what I said?
Yes. So he won't be in pain.
Yeah, it will cause a minimum pain.
Yes.
So there's nothing to be worried much. And also, this procedure is done by experienced hands, and we are taking each and every precaution to minimize the damage which can cause from this. But a little bit of bleeding can occur, but it's also very rare. Then I'll tell you what can be happen after the procedure. So your baby can feel a little bit of dizziness. So because of that, we are keeping his head low position after the procedure, and we are observing him for about 2 hours. There's nothing to worry that you will get the help from the nursing staff and the doctors as well for that observation. So, is there anything that you want to clarify more regarding up to now, the information that I have told you?
No. So I just wanted to make sure that he won't be having any excessive pain.
Yeah.
No, I think I got to know a lot.
Yes.
So, doctor, are there any other complications that can happen from this procedure?
Yeah. There can be a little bit of bleeding, and also if the procedure is failed, once we have to redo it, but it's very rare. Then I also want to tell you about the test results as well.
Yeah.
Do you want to know about that?
Yes.
Yeah, most probably the test results will be available after 2 to 3 hours. Then once the results come, we will let you know. And this is basically done to decide on the duration of antibiotics which we have to give for your baby. So if the test become positive, we have to continue giving antibiotics for about 14 days. There's no other option. But if the test become negative, we can stop the course of antibiotics. Did you get what I have said, or is there anything that you want to clarify or you want to know?
Yes, I think I got everything.
You can discuss this matter with your husband. And before doing the procedure, we want you to sign that you are okay with doing this test. So, if you want, we can arrange another discussion with your husband as well to explain regarding this procedure.
Yes.
So, are you all right with this information?
Yes, I'm alright, but I think we need to talk again about this with my husband. As
Yeah,
well.
sure. We'll arrange another chat.
Yes.
Yeah.
Thank you, doctor.
Yeah, thank you.